And again, together we are standing here, sitting actually, putting forth a united front on behalf of our neighbors and fellow residents who rely so heavily on Medicaid and other federal health care programs. You know probably some of the buzzwords that are going around right now. One phrase is that the bill that was passed will impose significant work requirements. Work requirements. I want you to keep those words, work requirements, in the back of your minds as you hear these stories, and ask yourself, does that have any relevance whatsoever to the stories that you'll hear? It's, again, incredibly abstract. You'll also hear words, fraud, waste, and abuse. Fraud, waste, and abuse. I would want you to ask the same question of yourselves when you hear these stories. Do you see a lot of evidence of fraud, waste, and abuse? You can imagine what the answer to that question is. And this is a harsh phrase, but I'm going to use this phrase because it's sadly accurate. Those are dog whistle words. Those are trying to divert our attention away from the painful reality of what this bill will do to human beings who live in our state. Again, I don't use that phrase lightly. Dog whistle words. Fraud, waste, and abuse, and work requirements. By the way, I haven't met one person who has anything to do with any federal health care or other program where if they could work, that they don't want to work. There's a willingness to work. Nobody said, I'm not going to work and I demand. The question is, can they work? What's the reality of the situation? And by the way, if there's fraud, waste, and abuse, sign me up. I want to get rid of that. But again, I challenge you all to listen carefully here and ask yourself, did you hear anything about fraud, waste, and abuse? Did you hear a story from anybody here where they could be working and they're not? Or they could be working more than they're working and they're not? But this bill is not actually about any of that. It's about gutting federal programs in order to pay for tax cuts. That's what this is. So let's just call it. I'd have a lot more respect for these folks who voted for it if they were honest about why they voted for it, because that's what this is. We think, again, $3.5 billion of eliminated Medicaid funding. That's nearly a quarter of about $14 billion that we get as a state. And that will, first and foremost, taken out on our vulnerable neighbors, but it's broader than that. It'll be hospitals, other health care providers. It's not just Medicaid. It's Supplemental Nutrition Assistance Program, otherwise known as SNAP, or otherwise known when I was growing up as food stamps. It is the slashing the subsidies that have allowed folks to apply for, engage, and become part of the Affordable Care Act. We're not really talking about it today. It's a big whack to Planned Parenthood. So it's a across-the-board betrayal of the people of New Jersey. I mentioned it passed by one vote, 215 to 214.